morning, everyone. I am Shanti Bariga, your student nurse for today, and I will be administering oral medication. Things that we are going to need is a liquid syrup, a tablet or a capsule, a measuring cup, a glass of water, mortar and pestle, and a physician's order. So the first step is to perform hand hygiene and observe the appropriate infection control and procedures. This is to reduce the number of microorganisms on the hands. So I am done washing my hands and donning my gloves. So the second step is to unlock the dispensing system, ensuring that medicines are dispensed correctly and any potential real errors which may occur during the dispensing process are detected and rectified before medicines reach the patient. Third, read the medication order and take the appropriate medication from the shelf, drawer, or refrigerator. You must know and understand all instructions and medications information such as side effects and critical warnings before giving any medication. Next is to compare the label of the medication container against the written order. Reading the label correctly can help patients make sure that they are taking the right amount of the medicine and that won't negatively react with other medications, foods, or drinks. So we're going to check the label. Also, check the expiration date of the medication. After the expiry date, medicines may not be safe or as effective. Prepare the correct amount of medication for the required dose without contaminating the medication in order to prevent your condition from getting worse or causing additional complications. Now, for tablets or capsules, place package unit dose capsules or tablets directly into the medicine cup. Do not remove the medication from the package until at the bedside. Like this. If using a stock container, pour the required number into the bottle cup and then transfer the medication to the disposable cup without touching the tablets. If the client has difficulty swallowing, crush the tablets to a fine powder with a pill crusher or a mortar and pestle that we prepared. Capsules have higher bioavailability, which means that more of the drug is likely to enter your bloodstream, assisting the client promotes effective action. For the liquid medication, thoroughly mix the medication before pouring. And then remove the cup and place it upside down on the countertop. Hold the bottle so the label is next to your palm and pour the medication away from the label. Place the medication cup on a flat surface at eye level and fill it to the desired level using the bottom of the meniscus crescent-shaped upper surface of a column of liquid to align with the container scale. So since my table is not at eye level, I will be doing this. Before cupping the bottle, wipe the lip with a paper towel. Keep unit dose liquids in their package and open them at the bedside. Now we will close the liquid medication. Liquid extracts have faster absorption rates, higher optimization rates, and are more easily digestible. So since I don't have any patient, I will be demonstrating it here. So the next step is to provide for client privacy. Provide privacy by shutting their curtains. Next is to check the client's identification bond, because verify the client's identity by checking the ID bond or bracelet to gather information. So assuming that my patient is here. So, hi ma'am, I am your nurse for today and you are Elisa Mantos, right? Okay ma'am, thank you. The next step is to assist the patient to a sitting position or, if not possible, to a side-lying position. This is to give patient comfort and assisting the client provides effective action. So the next step is to explain the purpose of the medication and how it will help to acquire patient's collaboration. So, hi ma'am, I am here to administer an oral medication that is prescribed to you. So I have here a liquid medication and a capsule or tablet. Thank you, ma'am. So the next step is to administer the medication at the correct time. Improper use of medication can lead to potentially harmful medication errors. The next step is to administer the medication at the correct time. Give the client sufficient water to swallow the medication. So here is the water. And use the pill cup to introduce the medication into the client's mouth. And give only one tablet or capsule at a time. Improper use of medication can lead to potentially harmful medication errors and potentially lessens the effectiveness of the therapy. For sublingual medication, instruct client to place medication under the tongue and allow it to dissolve completely. The drug enters directly into the systemic circulation, bypassing the enterohepatic circulation. For buccal administration, instruct the client to place the medication in the mouth against the cheek until it dissolves completely. This lets the medication or the medicine get absorbed through the tissue that lines the mouth and goes straight into the bloodstream. For nasogastric tube administration, NGT, crush tablets or open capsules and dissolve powder with 20 to 30 ml of warm water in a cup. So we'll gonna use the mortar and pestle to crush the medicine. Typically used for decompression of the stomach in the setting of intestinal obstruction or ileus, but can also be used to administer nutrition or medication to patients who are unable to tolerate oral intake. Next is to record the medication given, dosage, time, and any complaints or assessments of the client and your signature to affirm drug's activity. And lastly, dispose of all soiled supplies appropriately and wash hands. We'll now remove our gloves. And dispose it. This is to prevent transmission of microorganisms.